Hello, and welcome to the latest episode of Inside 340B Report. I'm Ted Slafsky, publisher and CEO of 340B Report, and I'm joined today by Shannon Young and Will Newton, who are both 340B Report associate editors and senior writers. Before we dive into the latest 340B developments, I want to let our listeners know that we're pleased to offer a special 25% discount to 340B Report first-time subscribers. You can go to the subscribe tab at 340breport.com and use the coupon code podcast25 to take advantage of the discount. I know you will find our news service to be a valuable investment. I also want to encourage you to check out 340B Report's new business area podcast, 340B Leaders Up Front, hosted by a longtime colleague of mine, Anna Mangum. The podcast showcases conversations with industry executives who are at the cutting edge of innovation and leadership in the 340B space. Today, we're going to discuss the ongoing federal government shutdown and how it's affecting the 340B program, the latest in the 340B rebate debate, including an upcoming exclusive 340B Report subscriber-only webinar this Wednesday on pressing implementation questions in HRSA's 340B rebate pilot program. And we're going to talk about a major pharmaceutical company's new policy tightening 340B restrictions on certain hospitals in the contract pharmacy setting. Let's start off by talking about the federal government shutdown. As of this recording, which is late Thursday, October 9th, we're more than a week into the shutdown with no clear signs of an impending deal. Tens of thousands of federal workers have been furloughed, including at the Health and Human Services Department and the Office of Pharmacy Affairs. Shannon, can you tell us more about what this all means for 340B stakeholders?
Yeah, so it's still a little early to say how exactly the federal shutdown is going to affect the 340B program. And that's largely because it depends on how long it goes. So as Ted mentioned, we're more than a week into it. It started October 1st when federal funding lapsed. And so, everyone had been kind of preparing for this. HHS had a contingency plan, and HRSA had prepared to furlough staff ahead of the shutdown. And so when it happened, the agency had been planning to furlough about 47% of its staff. And that left over 1,000 workers in HRSA, 43% of whom are considered exempt and 11% of whom are accepted. Or whose activities are deemed necessary. So HRSA did not specifically say if the furloughs affect the Office of Pharmacy Affairs staff who oversee the 340B program. But sources have told us at 340B Report that OPA staff appeared to be included in the furloughs. And then also HRSA noted in its contingency plan that 49 Public Health Services Commission Corps officers will continue to work as accepted. And so that's what we know in terms of who's working and who's not. We also saw a politically charged notification that went up on the Office of Pharmacy Affairs Information System website, and it included language that we haven't really seen in past shutdowns. It started off, due to the Democrat-led shutdown, HRSA's Office of Pharmacy Affairs staff will be unavailable until further notice. I continued that the 340B Office of Pharmacy Affairs Information System will remain online during this time, and the system will be able to continue accepting covered entity and contract pharmacy registrations for the open registration period of October 1st through October 15th. It also noted that change requests, termination requests, and or contract pharmacy termination requests can also still be submitted. However, HRSA staff will not be available to process the registrations or to provide technical assistance. And then just of note, Apexis, which is the prime vendor for 340B, is still fully operational despite the shutdown and is continuing to work with stakeholders, but some of their work could be obviously affected by the shutdown. And so here's why all of this matters. The shutdown comes as HRSA is moving to implement its 340B rebate model pilot program. And we've been talking about it for weeks on here. There's a lot of changes that would be coming with that. There's been a lot of deadlines. And so right now we're coming up on an October 15th deadline where HRSA is supposed to approve drug makers' proposals for their rebate pilots. And it's also promised a 60-day notice prior to implementation of those pilot projects. And so that would put us around November 2nd. And so to meet the January 1st deadline, that would be. So if we go past November 2nd here with the shutdown, there's a lot of questions that are being raised as to when does implementation actually take place. So a source has told us that some Office of Pharmacy Affairs staff could be spared from furloughs because the rebate model pilot program is tied to the Inflation Reduction Act's Medicare drug price negotiation program. And that is also set to go live on January 1st. CMS has exempted its staff who are working on the IRA in its shutdown contingency plan. So there could be some hope there that everything is on schedule for January 1st. But we'll see. And that's just, again, because HRSA's proposed rebate pilot model would only apply to drugs selected for Medicare drug price negotiations in 2026 under the IRA. The agency would have to sign off on drug makers to implement any of those proposals. And then beyond the rebate pilot, the federal funding lapse could also hurt disproportionate share hospitals, rural hospitals, and community health centers that often rely on government support through various grant and subsidy programs. It could also affect 340B audit activities. So that's just some of the stuff that we're keeping an eye on. Ted, is there anything that you want to add here about the shutdown and its implications?
Yeah, well, I've experienced a lot of government shutdowns over the last 30 years or so, particularly in the last decade or so. But this was the first time I saw language that was, as you mentioned, so politically charged, basically blaming one political party for the shutdown when in fact it takes two to tango. And so I thought that was really striking. And a lot of journalists and other observers noticed that it's a more politically charged environment, which I think makes a lot of the folks at HRSA and the Office of Pharmacy Affairs uncomfortable because virtually all of them are career employees and they don't really work for one particular party or one particular president. So that's one thing that I've noticed. And besides the fact that we now have a number of the staff, probably most of them are not able to work. They're also going without a paycheck and potentially without several paychecks, which is really difficult because, as most people who understand how much a federal government employee makes, they actually do not make a lot of money. So it's particularly tough in places like Washington, D.C., where a number of us live. And as you know, it's very, very expensive around here. So I'm hoping that this will get resolved expeditiously and that hopefully all the government employees who really are the victims of this shutdown will get back pay because I know they all want to be working and it's not a lot of fun to either be working and not being get paid or not working and feeling helpless during this period. So I want to give a shout out to all the folks at the federal government who are in this difficult bind.
Yeah, thanks for that, Ted. And again, this is something we're going to keep our eye on and keep reporting on. And while the stakeholders wait to see how the government shutdown will affect HRSA's 340B rebate pilot, there's also major implementation questions about how the proposal will play out. Will, can you tell us some of the biggest concerns stakeholders have raised and the upcoming exclusive 340B report webinar that's going to dive into some of these issues?
Definitely. And as you said, given the shutdown, we're not really even sure at what point HRSA will actually tell us which rebate proposals got approved. But even once HRSA does make that announcement, there are still tons of implementation questions, lingering concerns out there. And chief among them, I would say, for the provider community is the potential administrative and financial burden that this could place. The American Hospital Association recently put out a report arguing that by their estimations, this rebate pilot just in 2026 alone would cost hospitals more than $400 million. AHA also said that most hospitals would have to dedicate 2 full-time staff members per hospital in order to comply. So there's tons of implementation concerns there as well. And even when you get to especially smaller covered entities, rural providers, health centers, there are a lot of concerns about floating the drug industry money and potentially even having to take out loans in order to pay for these drugs or pay for the wholesale acquisition costs rather than the upfront discount that providers have been relying on. Also, even beyond the providers themselves, I know other parts of the drug supply chain, there are a lot of implementation concerns there, certainly from the wholesaler perspective, from the TPA perspective, TPAs being third-party administrators that work with covered entities to help optimize and improve compliance in their programs. So there's really so much to dive into and so much we don't know about right now, and including but not limited to the fact that drug manufacturers are going to be using their own technology platforms to administer this rebate. And so even complying with that, integrating those platforms with the existing structures that covered entities, TPAs, and wholesalers do. So a whole host of issues. And I'm very excited coming up on this Wednesday to have the opportunity to moderate a panel as part of an exclusive 340B report webinar for our subscribers, where we will be talking to some of the leading voices from all sides of this and all parts of the drug supply chain to really dive into some of the very specific and pressing implementation questions and really how everybody here can kind of proceed and stay prepared. So our 3 panelists are going to be Catherine Richardson, who is the managing director at Second Sight Solutions. For those of you who don't know, Second Sight Solutions is the parent company of 340B ESP, which has been administering a lot of the 340B contract pharmacy restrictions. It's also the parent company of Beacon, which is a rebate software platform that 4 of the 5 drug manufacturers that have sued to implement their own rebate models were using. So I would say it's very likely that Beacon will be playing a big role in these rebate proposals that manufacturers have been putting forward. We're also going to be speaking with Larry Crowder, who is Vice President of Strategic Accounts at Morrison Dixon, which is a wholesaler. And wholesalers play a very active role in the 340B space and are going to have to make a lot of changes with this pilot coming up. So it'll be really interesting to hear his perspective as well. And finally, we'll have William Von Osen, who is a principal at Powers Law Firm. He has been working with covered entities for a long time, ever since the program's inception more than 30 years ago. And he'll share some thoughts on rebate implementation concerns and litigation from the provider's perspective. So definitely a lot for us to dig into. And Ted, I know you're also excited about our webinar. Can you tell us a little bit more about what you're looking forward to hearing more about?
Sure. Yeah. Thanks, Will. I'm very excited for this webinar. We have close to 1,400 of our subscribers already signed up for it. I think it's probably our biggest turnout ever. So that's really sort of a reflection of how important this issue is to everyone in the 340B community, both from the provider and manufacturer perspectives, as well as from others in that supply chain. So we've actually devoted an hour and 15 minutes for this webinar, which is longer than our traditional 1-hour format. And that will take place this Wednesday, October 15th. If you are not a subscriber to 340B Report, you still have time to become a subscriber at 340breport.com and join us. And you can join us at that 25% discount that I gave out at the beginning of today's podcast. So it's going to be an excellent discussion. And Shannon and I will probably be culling through all the questions, which I'm sure we're going to get a lot from the audience in reading those to both you and the fellow panelists. So thank you, Will, for your help in putting together this webinar. And I look forward to working with you, Shannon, on this upcoming event.
Yeah, thank you. Thank you so much, Ted and Shannon, as well. And yeah, if you enjoy listening to this podcast, I'm sure you'll love the webinar. Now, before we continue and get to the next topic, we're going to take a quick moment to hear from one of our great sponsors.
Verity Solutions is a proud sponsor of 340B Report. In today's dynamic landscape, having the right solutions and a dependable partner is more vital than ever. Verity's innovative, award-winning 340B program management solutions are designed to optimize your 340B pharmacy spend and maximize your pharmacy supply chain savings. Verity is dedicated to helping you find new program opportunities and streamline workflows, resulting in more resources to enhance patient care. Visit Verity340B.com to start your journey today.
Switching gears, Pfizer recently tightened its 340B contract pharmacy restrictions in a move that appears directed at certain hospitals that are in the program. Shannon, you wrote a story about this earlier this week. Can you tell us more about what you discovered?
Yeah, so without getting too far in the weeds, Pfizer informed some 340B hospital covered entities that they could lose their approved one contract pharmacy exemption registered with industry vendor 340B ESP as of November 1st. And these were hospitals that the drug maker deemed to be not compliant with this policy. The change followed a review of 340B shipments to hospitals with an approved one contract pharmacy exemption. They claimed that these hospitals had shipments delivered to multiple addresses instead of just one, and that's sort of why they're being targeted here. And it's part of a larger trend we've seen in the last couple of weeks and months where drug makers are really tightening the restrictions, trying to crack down on some of these rules here. And it's unclear what exactly it's coming in response to, but noteworthy it is coming as a lot of states are passing laws to, get rid of these restrictions. And so maybe there's a tie in there. Hospitals and other providers, for their part, are raising questions about these changes, what they mean. They haven't gotten a ton of clarity exactly on what they mean, how they'll be affected, and they've argued that it could affect patient access to 340B priced drugs moving forward. We also have reached out to the drug makers, including Pfizer, to get a little bit of clarification here on these changes, why they're happening and how they're going to be implemented, and haven't gotten a ton of details ourselves, but I'm sure it's something we're going to keep hearing about from our subscribers, our listeners, and affected covered entities in the coming weeks. So this is just something to keep on your radar screen.
Yeah, thanks for all of your coverage of that, Shannon. And I know Pfizer also made some national headlines with a newly announced prescription drug pricing deal with the Trump administration. Shannon, you wrote an article about that recently. Can you tell us a little more about that development and how it could potentially affect the 340B program as well?
Yeah, so if you've been following along with us for the last several months here, you will know that in the spring, the early part of this year, President Donald Trump announced a plan to implement a most favored nation policy when it comes to prescription drug prices. And that's an attempt to bring what the U.S. pays for prescription drugs in line to what's paid by other similarly situated countries, other major countries with, like the UK and some of those ones. And so we haven't gotten a ton of details up until this point. The administration's been working with drug makers largely behind the scenes. And he gave them a deadline of about September 29th to come forward with different policies that meet a whole bunch of milestones, I guess, for lack of a better word, that he would like to see drug makers do to lower prescription drug prices. And so we really got our first look at what this could entail in the past 10 days or so. Pfizer reached a deal with the White House where it said it will offer all of its medications to Medicaid at the most favored nation price, or what other comparable Western nations pay for the same drug. And they will launch any new U.S. medications at reduced prices in exchange for a tariff grace period. Pfizer will also offer some of its drugs at a reduced rate on the Trump administration's new direct-to-consumer prescription platform known as Trump RX, which is expected to launch in early 2026. And just a side note, the drug industry trade group Pharma also announced a similar direct-to-consumer platform just ahead of Pfizer's announcement with the White House. The trade group, which represents several major drug manufacturers, however, didn't make a ton of news in terms of what its plans are for most favored nation prices. So that is still unclear there, but we are expecting other drug makers will reach similar agreements with the White House, especially since the president has recently floated the idea of 100% tariffs on foreign drug pharmaceutical prices and things like that. And so they're currently on pause, but that's something that's coming that a lot of drug makers are trying to avoid. Now, some analysts have been skeptical of this Pfizer agreement and specifically the impact of most favored nation priced Medicaid drugs. They've noted that significant discounts already exist through the Medicaid drug rebate program and sort of questioned why they would need to be available at an MFN price when they're already so cheap. 340B advocates have also pointed at this as an example of how the drug industry's claims that 340B drives drug prices are just not accurate. They've said clearly it shows that the pharmaceutical industry is in charge of its pricing. So it's recent arguments that we've seen in ad campaigns trying to tie hospital markups to 340B. They just said that it rings false, and this is sort of why. And so I expect this to continue to be an area of debate that we see again in the next several weeks. Pharma is still running these ads, and they're also trying to work deals with the White House. So I don't expect 340B advocates to stay quiet if we're seeing more of these agreements being announced.
Yeah, I think it's interesting, Shannon, that the discounts that are being provided largely are in the Medicaid market that's already getting, as you mentioned, very good pricing. It may not be always as low as the prices in other Western countries, but there are already pretty low. So it's questionable the extent of these discounts that are being provided, particularly since, as you mentioned in your articles, and I think Will has as well, a lot of the folks get their medications either through a federal government insurance program like Medicare or Medicaid, or they get it through the private market through their insurance company. And so those folks aren't necessarily going to be benefiting much from this, but it could potentially have some benefit for those who purchase their drugs, not through insurance, but through cash payments. So I'll be interested to see how this plays out and how much impact it will have on, and what impact it will have on both patients and 340B providers. So I know we'll be keeping a close eye on that issue as well as many others. So with that, we're going to end today's episode. It was a good discussion. I really appreciate both of your input, and then we'll be back in 2 weeks with a new episode where we'll cover anything else that's happened in the 340B related world. And of course, we'll be reporting on everything that happens in 340B in the meantime on our website. Please follow along with our twice weekly newsletters. And just a reminder, if you're not currently a subscriber, you can take advantage of our 25% discount for first-time subscribers only by going to 340breport.com, clicking the subscribe button, and using the discount code podcast25. Thank you for joining us today, and I hope all is well with you.